That is actually.
Okay, good evening, everybody. Good evening, everybody. Welcome to the May 2024 meeting of CB11's Human Services Committee. My name is Isaac Scott and I'm the chair of the committee. This meeting is called to order at 6:07 p.m. Tonight, we are joined by Marlene Pierre, the staff liaison to our committee. In order to conduct an efficient meeting, let's observe a few ground rules. Firstly, no one may speak until granted the floor. CB11 members, if you have a question about board business or if you wish to make a motion, please raise your hand and wait to be recognized. If you are on, I guess I erased too much in my script, but if you
Yes,
are
you
on.
could, Isaac, just, you could see that?
Oh, there we go.
Just-
Okay.
I'm here to make your life.
Okay. If you have a question about board business or wish to make a motion, please raise your hand and wait to be recognized. To raise your hand through Zoom, click the participants icon and you will find the raise hand function there. Members should not engage in a back and forth discussion. The chair will recognize the next person to speak. Please keep your questions and comments brief and on topic to the discussion, please. Members of the public, if you have a question or comment about subjects on the agenda, please raise your hand and wait to be recognized. And I will add to that, since we are not using the chat function, we may ask you to just repeat your information on the record if it wasn't clear enough. So now we will take attendance by roll call. Committee members, please answer present when your name is called.
Mark Roguski,
Present.
Brandon Gillespie. Jennifer Meyer,
Present.
Isaac Scott,
Present.
and Robin Strayson. Present. You have a forum.
Thank you. The agenda for tonight's meeting was distributed ahead of time by the board office and was posted online. If there's no objections, we will adopt the agenda as stated. Committee members, if you object to adopting the agenda, you may raise your hand and wait to be recognized. All right, seeing no objections, the minutes from our last meeting were distributed to the committee members ahead of time by the board office. If there is no objection, we will adopt the minutes from that meeting. Committee members, if you object to adopting the minutes, you may raise your hand to be recognized. Seeing no objections, the minutes from our last meeting are adopted. They will be soon ready on the website for view. All right, from here, we'll transition, also the minutes for tonight's meeting are being taken by myself. The announcements, we're gonna transition now to our announcements. I do not have any announcements. Yeah, I don't have any announcements. I won't tell you why, but I don't have any. Are there any announcements from any committee members? Any public events, anything, any announcements from anybody in the Zoom space? Any events coming up you wanna let us know about? Anything like that, we have a hand, I see a hand popped up.
That's, Sloan Kettering, maybe it'll go in her information on
Yes,
this.
so yes, if you are scheduled to give an informational update, you can just hold off. We're just we're soliciting random announcements at the moment. Anything that just might have popped up on your plate, you're gonna share with the community while you have the floor. Okay. If not, circle back by raising your hand and we'll grant you the floor. Okay, with that, we'll transition into our informational updates and we will grant our first presentation to the Center for Comprehensive Health Practice, CCHP, because they were kind enough to join us in person. So thank you, Michelle. Thank you.
Thank you, everybody. It's really nice to be here in person and to see everyone and meet some of you finally. So my name is Michelle Godot. I'm the Chief Operating Officer. This is Shannon Risbrook. She is our new Community Engagement Coordinator. Shannon will be attending these meetings sort of moving forward, or if I'll be here, she can't make it, but I wanted to have her come in person, get to meet everybody. And to know that we are really like ramping up our outreach efforts. And Shannon's leading our outreach team. And so we've been going out, working a lot with the food pantry, and are looking into more relationships and connections to go out and do distribution of health education. We're doing the Loxome distribution. We're also doing rapid HIV testing. We have fentanyl and xylazine test strips that we're giving out and can teach people how to use. And we also have some new funding and like initiatives that we're looking to really ramp up. Specifically in this realm with our substance use treatment, but working with pregnant persons, formerly incarcerated, and transitional youth as well. So we're looking for partnerships to bring in patients and connect them to services that they would need at CCHP or elsewhere. But just always want to say hi, and we're so excited to be part of the community board and be part of the community and be welcomed here. So thank you.
Thank you for having me.
Yeah.
Are there any questions for CCHP? They'll be with us, so feel free to look into the work that they are doing and bring any questions that you have at any later meeting. So we will, just so everyone knows, we will not be meeting most likely July or August, so we will adjourn for the summer months. Okay, yeah, so we'll adjourn for the summer months, so we have one more meeting this fiscal year. All right, so with that, we will, any questions from anyone online? Sorry. Anyone in the Zoom space? No? Okay, good. Thank you, guys. We appreciate you. So with that, I'll transition to the Department of Health and Mental Hygiene. Do we have any? I see Paul. No, no one. Okay. So we'll go on to East Harlem Co-ed.
I don't see anyone from the co-ed either.
Oh, really? Okay, what's up with that? Okay, I know we have someone on from Memorial Sloan Kettering. Who do we have on?
Yes, I'm Maribel Rodriguez. I'm with Sloan Kettering. I'm the senior project coordinator on the team with Shakima Grant. I just wanted to share some upcoming events that we had with Ralph Lauren.
Yes, go ahead. The floor is yours.
Okay, so we have on this Saturday, May 18th, it's the Uptown Grand Central Harlem Wellness Fair. We'll be providing free in-person Tai Chi classes as well as sharing information about cancer screening and prevention. We will also share that the free Tai Chi classes are being hosted via Zoom every Tuesday from 6 to 7. On 5/21, the mobile health unit will be at East Harlem Neighborhood Action Center, providing free cholesterol, glucose, and blood pressure screenings, in addition to an opportunity to schedule any cancer screening appointments at the Ralph Lauren Center. The team will also assist with any insurance enrollment and general healthcare navigation. And on June 2nd, at the Sister Studio Survivorship Sunday event, we're providing a clinical speaker on breast cancer, as well as sharing information about scheduling breast cancer screening appointments at Ralph Lauren Center as well. Sorry, that was
Thank you very, very much for being here and for providing us updates. Are there any questions from any board members? Any questions from anybody in the Zoom space? Okay, so thank you very, very much for being here. Thank you very much for sharing that information, and we are very, very happy to have you on our informational update section.
Thank you.
All right, so with that, we can transition into our first presentation. Do we have Earlene Wilkerson on?
Yes.
Are you able to unmute?
Can you hear me?
Yes, we can. Please introduce yourself and you have the floor.
Thank you. I am Earlene Wilkerson, and I work for the Center for Human Development and Family Services, which is a nonprofit agency that works directly with the Administration for Children's Services on child safety conferences. I supervise the parent advocates, and they work directly with the families that are being investigated about situations that has put them and their families in harm's way. I always explain to my families how easy it is to get a case with ACS and how difficult it is to end the case. But the parent advocates work tireless to do the best job they can do, sitting with the families and listening to what they are saying so their voices are being heard because they know their children better than we do. I started this position from the beginning as a PTA president when my children were in elementary school and continued and followed them through middle school. By high school, I became a parent coordinator for the High School for Arts and Science in the Longwood section of the Bronx. During this time, I engaged as a community rep. In the hybrid section of the Bronx, where I have raised and lived 49 years and raised 7 children and 12 grandchildren, it's been a rewarding experience. To be a parent advocate, you have to have had some experience with ACS, maybe a case at one time or another, or a foster care giver, or possibly a foster child yourself at one time or another. The parent advocates go through a series of training so they know how to help our families. Having a parent advocate by your side at the initial child safety conference is a great support to the families to know that there's an advocate there to listen to you. The children's safety conferences last for about an hour and a half and has about 6 stages to them. The first stage is the caseworker contacts the family to inform them what has happened by coming to your home. You can allow the work into your home, or you cannot allow them, or they can come back with a warrant. Either way, they will come back and you will want to know what's going on. If they come back, the caseworker may call for a child safety conference, which you will be asked to join at a scheduled date and time. If you do not attend, the conference will resume without the parent, and you will be informed when they make a decision without your voice, which your parent advocates would not recommend. There's nothing about you without you. Okay. Um, During this conference, there's something called family time, where you allow up to 15 minutes to speak with your parent advocate, to speak privately, just you and a translator if necessary, and the advocate to discuss the services you have been asked to participate in. Realistically, when you are asked whether you want to engage or not, please let your advocate know services don't help your family if there's something you don't think will work for you. Then people don't even want to try them. So I'm going to cut in the middle and just talk about the fact that these are the services that we're offering a lot of the communities. And to speak to the community board gets the word out. There are a lot of families that are going through ACS, Administration for Children's Services, cases, and they don't know who to turn to. When you have a case with ACS, the caseworker will speak to you. They will invite, if it's serious enough, they will invite you to a child safety conference. When they invite you to the child safety conference, an advocate will be there when you attend. She will introduce herself to you, tell you what her role is, and how she's there to help you. The parent has to give the advocate permission to either sit in on her conference or not. Once permission is given, then the advocate sits in the conference. The caseworker explains why they're there, the reason they're there, and what concerns they have about the family. Then the conference runs in about 6 stages. First, they tell you why you're there. Then they tell you what ACS's concerns are about your family. Then they talk about strengths, resources, things that work well for the parent, because everybody has something that works well for them. And then they talk about uh, things that you do well for your family. Getting them ready for school, being part of the school, you know. Um, and then the ACS team, will start talking about recommendations, things that they think that they've identified that work well, might work well for your family. After that, they talk about you sitting with your parent advocate for up to 15 minutes. And the parent advocate will go over the parent advocate will go over the services, explain them, and ask, would you be interested in these services? This is the time when this is one-on-one with the parents and the advocate. So you get 15 minutes, up to 15 minutes to speak to your parent advocate. She talks to you, or he talks to you about, we're recommending this, they're recommending certain services like parenting classes, and then you can honestly tell your parent advocate, well, I don't, whether you really are interested in that. We don't recommend, in order to do these services, you have to be interested in them. You have to feel like they're going to help your family. You can also recommend services for your family if ACS hasn't recommended something that you think might work for your family. After you work with your parent advocate and talk about what services you think will work for your family, then the team comes back together and your parent advocate or yourself will tell them what they agreed to. Okay. ACS then makes a decision on, well, this is what we're going to ask the judge if this case goes to court. Most times it does. And you will have a lawyer that will speak on your behalf to the judge, either explaining why you don't want this service, what's your reason for not taking this service, and then the lawyer will speak to the judge. A decision is then made, but the decision is only etched in stone if it's made by the judge. So your lawyer might explain, well, Ms. Jones does not want this service because she don't feel like it fits the needs of her family. ACS can still ask the judge for that service, but if you have a lawyer, he can tell why you feel like you don't need it. The judge has the final say. These are the resources that I'm offering to the community board 11 and any of the parents that might need our services. It's very important that your voice is heard because, again, like I said, no one knows your children like you know them. And so it's important to hear your voice. And so we are the Center for Human Development and Family Services, and we're offering this service if anyone needs us. You can find us online as Center for Human Development and Family Service, or CHDFS for short. Okay. Is there anyone that has any questions about what I just?
Thank you, Ms. Wilkerson. I do have a few questions. So do you have to be involved in ACS, or do you have to have an open ACS case to benefit from the services you're providing? Yeah.
Well, that's how we get involved. We get involved when a case is called into the state central registry, and the caseworkers investigate, and they come to your home and tell you what's going on, or tell you why they were called in. So that begins the case with ACS. And when they feel like the case is important enough, which all cases are important, they offer the family a child safety conference. When you decide to go, because there's a lot of parents that don't want to be in a room with ACS without somebody on their side. And I'm not saying ACS is not on your side, but they have to do their job. So it's very important to have someone hear your voice, listen to what your side of the story was or is. So that's why we're going around recommending this service to all parents that may need it.
Thank you. That very much answered my question. We have another question in the room.
I just had, I'm gonna try to make it brief. I was a former foster care caseworker for 3 years, so I'm very familiar with what she's speaking about. I used to have to work with parent advocates. However, Ms. Wilkinson, I just want to differentiate. So, State Central Registry, we all know that I've had to do that a few times, unfortunately. So case gets called in, CPS worker, the case planner that she's talking about, CPS worker goes to the home to do the investigation. They then go to court, and petition for, the child to be removed or preventative services to come inside the home. So are you speaking about preventative services? That's the leg, the child is not in care yet. That's a whole nother branch of it, like it's. Mhm.
So the child safety conferences are before all of that.
Okay.
When they find that there's a situation that put a child or a parent, anyone in danger, the child safety conference is what they do first.
Right, it's the child is imminent danger, right? So it's like, it's right now, they need to investigate and get involved, yes.
Yes.
Okay.
And
Okay,
so that's when they will come and ask you to participate in the child safety conference.
okay, so, can I ask something, please? So, what, since this is under, you are under, right, so you're with an agency, you're not under the auspices of ACS.
Not at all.
Not at all, right,
Not
so.
almost. Go
And
ahead.
I used to get that energy from parent advocates too. I used to be like, we're not the enemy. I'm coming at the last leg of this, right? It's like the child's already in care, like, it's already founded, in family court. That's what it's called. The case, criminal court says guilty, family court says founded. The case has been founded for some type of neglect, right? So I would ask if you can disseminate information for us to display in office. Since the location of your agency is not in this district. It would be helpful to do it that way.
Okay, so we are at 307 West 38th Street. Okay, that's
Right.
where this office is at, the Center for Human Development and Family Service. But we work in the Bronx offices, the ACS offices in the Bronx. There's one at 2501 Grand Concourse. There's one at 1200 Water Place. And then we also do the Manhattan offices, which is Williams Place, 150 Williams. And we do Staten Island. And we do a few in Queens. So we cover those offices. So whenever a case comes to any one of those, we have another group, another agency that does Brooklyn and parts of Queens. But we do mostly all the other ones. So we do cases that are in those boroughs in which I just referred to and those offices. But of course, I will send you all types of information that you can display
Okay.
and give out to the parents, that because we know these are trying times and it's a lot going on.
I have another question. Do you guys come out to, like, would you come and do a presentation to the church and places like different community spaces about this?
If needed or if wanted, and we welcome anything that can get all of this information to all the people or anybody that needs it. And I'm sure that everybody knows somebody that either can use this or it's just good to have it, because we never know what comes up. And so,
Okay, we have another question in the room. Thank you.
Yeah, Arlene, thank you for your presentation. I'm just curious, I was saying to somebody else in the room that one of the hardest things about being new to the community board is learning of all these agencies that exist and what they do. But I'm just curious, how are you funded? What is the mechanism by which you actually can provide these services to families, which sound remarkably important to me?
well, we work with ACS. We don't work for them, but we work for them. So we kind of work together with, when the parents get services, we help check on the services to see if it's something that they really can use. So why having family time with our families, we're able to tell them, they ask questions. Well, I don't like this parenting class, or I don't think I need parenting. And we talk to them to ask them, what do they feel? How do they think? Or what do they think and how do they feel? If this is something that you feel, or you want to give it a chance to see if it'll help you out with your family. Or, like I said, the parents come up with ideas that maybe ACS doesn't come up with, and they'll ask, well, I think my family might need preventive, or it might work better if I do. And there's so many different types of parenting classes. They're called Parenting Journey, where there's also children, different age groups have different parenting classes. Children with special needs have certain parenting classes for the parents. So we want to put you where you fit in. All right, so all these things are available, and I really would like parents to get to know us. Because there are sometimes parents don't even want to participate because they're all alone by themselves and don't have anybody. And when our parent advocates sit with them and let them know that they are here, there's nothing about you without you. These are your children. ACS didn't have these children. Y'all had these children. You need to be adamant about what they're going to do or what they plan to do. And if you can work it out, we want you to have the opportunity to work it out.
Thank you.
So thank you all for listening to me, because I'm very passionate about it. I've been doing it for a long time, and I've seen it work. So ACS is not the enemy. They just have to do what they are responsible for doing. But you as a parent need every opportunity to do what you are responsible to do. And you should get a chance to do that. Thank you very much for listening.
No problem. Are there any questions from anyone in the Zoom space? No? Okay, thank you very much again for your presentation. I will be in touch with you about maybe possibly presenting in a community space, but I definitely know a lot of people who find themselves caught up in ACS, so I'm sure that they would be very, very they would want to know this information.
Thank you very much.
Well, thank you. Thank you. Okay, you have a good evening. Thank you.
You too.
Okay, so we will transition now into our next presentation, which is from the Jewish Board in the Manhattan Certified Community Behavioral Health Clinic. Do we have Norma on?
Hello.
Hi, I didn't want to mess up your last name.
Don't worry about it. I still don't pronounce it correctly, and I've been married for almost 10 years now. So yes, my name is Norma Cruz Judone, and I'm the project director from the Jewish Board's Manhattan CCBHC. So I have a slideshow presentation. Should I just share my screen?
Yes, we love pictures and visuals.
Okay, so let me do that. Alrighty, can everyone see my screen?
Yes.
Beautiful. All right, so let me change the configuration. And if I'm looking like to the side, I apologize because I have a bigger screen here. So, but yes, as I mentioned, so hello, Community Board 11. Thank you so much for having me so I can be able to do this presentation. So my name is Norma Cruz Judone. I'm a project director for Jewish Board's Manhattan CCBHC. We cover both Community Board 11 and 12. So this is specifically for this community board. Just going to give you some like background context information of what the CCBHC is, how Jewish Board is doing right now as far as like starting the partnerships with our communities, and also like how Community Board 11 can help. So I'm just going to go through this. It shouldn't take too long. Alrighty. There we go. So just a couple of some background information about Jewish Board. So we have our mission statement, which is that the Jewish Board empowers New Yorkers, providing integrated mental health services and social services with compassion and expertise. Our vision is to transform lives and communities through clinical and operational excellence. And here are some of our values. Treat every person with dignity, And we want to be able to treat people with respect for not just for our clients, but for our colleagues and within our communities. We strive to be outstanding. So we are all working on, if not doing professional developments. We have a great training program for a lot of our mental health clinicians, either people who are just coming from school or people who've been in the field for a very long time. We pride ourselves on being able to stay, up to snuff with all of the forever changing modalities that we have in mental health services. We engage with individuals and families as our partners. We aim to heal our communities one person at a time through thoughtful collaboration, which is fantastic for the CCBHC model. And we strive to be outstanding. We are exceptional professionals in all that we do, and we just want to keep on striving to do better and be better. Okay. So we're a CCBHC, but what does that even mean, right? So a CCBHC is a certified community behavioral health clinic. So we apply for a SAMHSA grant, and we are granted a grant. And in this grant, we promise to design and ensure access to coordinated collaborative behavioral health services, not just for mental health, but also for substance use, regardless of their ability to pay, place of residence, or age. This includes developmentally appropriate care for children and youth. So we have mental health services. We've been servicing the community for over 100 years, ranging from 6-month-olds in our early childhood programs to elderly adults and everything in between. We have an array of mental health services. As I mentioned earlier, the CCBHC is a grant through SAMHSA, so it's a 4-year grant that ends in September of 2027. So here in Manhattan, did the SAMHSA grant in September, and so we're still in the early stages of developing a lot of the programs and partnerships that would have us be very successful. And from the beginning, we're talking about how to sustain this program, because we understand now more than ever that mental health can no longer function in a silo, right? Mental health providers cannot solely just be mental health providers. We have people who have very complex medical conditions and a substance use history. And traditionally speaking, mental health in the olden days, if you had substance use, you went to a different program. If you had a dual diagnosis, you went to a program that solely worked under dually diagnosed individuals. If you had a medical complexity, talk to your doctor. That's not my thing. We can't do that anymore, right? Because we understand in the mental health world how everything is cyclical, everything could be correlated. And with this grant, it's going to really give us the opportunity to really embed ourselves in the community, but also expand our level of services, not just as a mental health provider, but as a community provider. So some of the requirements for CCBHC does include providing crisis intervention services. Community behavioral health is what we're generally pretty good at, right? We are known to do mental health very well, but care coordination is something that is relatively new to us. And so care coordination specifically around physical health care, social services, and other community behavioral health or community services as a whole, other CBOs. This is where we need support, because we've never had to integrate these models before. And now with the grant, it gives us the opportunity to really kind of look at an individual, not just by their mental health diagnosis, but as a whole. And developing a lot of these partnerships within our grant lends ourselves to really provide that idea of holistic care. Okay, so our Jewish board programs that fall under the CCBHC, we have 4 CCBHC hubs is what we call them. And so we have different iterations of the grant throughout the 5 boroughs in different stages of the grant. So we have our Brooklyn and Staten Island teams that are probably in year 2 to 3 in their grant. So they're like towards the middle, closer to the end of their grant. Whereas the Bronx and Manhattan, we are newer in the CCBHC hub model. So we have a little bit more wiggle room, but our services within Manhattan include our 2 locations, our 2 mental health clinics, which is our Leonard and Virginia Marks Counseling Center, which is located on, oh, sorry, it's a typo, it's 34 West 139th Street, not 39. So it's 34 West 139th Street, which is around the corner from Harlem Hospital. And then our Manhattan North location, which is in our Inwood, Washington Heights location, which falls under Community Board 12. We have a facilitated intake team, we call them the FIT team. And so we have a specific team dedicated and devoted to doing all of our intakes. We do them both hybrid, so we can do them via telehealth. We also do them in person. We also have a COPS modality, so people who are coming straight from the hospital, who is more of an urgent matter to get them referred. We have a pipeline so they can get services immediately upon discharge. And those are all handled within our facilitated intake team. So every hub has their facility intake workers. So they're all social workers who are providing the initial intakes, comprehensive psychosocial assessments, and then we are assigning to the appropriate therapists based off availability, language, and client preference. So whether they prefer males or language or nights or days or afternoons, we have a varying degree of operating hours from as early as 8 in the morning to 8 at night. And because we have the hybrid model, we have a lot of people who are asking for services because we operate at all different times of the day. We also have our Bridges to Care team, which is our short-term care management team. So these teams are embedded into our clinics. And so when a client comes in for intake and they'll say, I haven't had my food stamps in 6 months, we get an alert that we have a person who's in need of any kind of case management services, and we help them through that process. We give them the information to HRA. If they need accompaniment to said appointments to HRA or Social Security, any kind of public benefit system, we provide that level of support and make sure they get their care. So essentially we bridge them, it's in the name, we bridge their care to make sure they're getting their additional services. Because what we find is that in a lot of clinical modalities, a client can spend half their session talking about a lot of these very concrete needs that clinicians generally wouldn't know what to do or how to handle it, right? So the idea is that we take some of that load off of a clinician and really address some of those concrete needs in conjunction with the therapist, right? Sometimes supportive housings need psychosocials and psychiatric evaluations. And so we work in tandem with a lot of our clinical providers, but really kind of giving that space of just like, yes, you're coming here for therapy, but also we are able to support you in other things that may be impacting your mental health. So that's our Bridges to Care team. We also have ACT, both adult and children's across both clinics, both Manhattan North and Harlem. And we have care coordination teams, both for Medicaid and non-Medicaid beneficiaries. And that is for people who have maybe more complex needs or have needs that will take longer than 6 months. So will not necessarily appropriate for a short-term intervention, but would need ongoing support and follow through. And then we have a pending licensure for CORE and CAFDIS teams. And so these specific teams are an enhancement of mental health services through either OMH, or I'm not 100% sure where CAFDIS comes from, but I know for CORE, that comes from OMH. This is primarily peer-led. So we have services that are also sometimes care management services, but also can be done by peer services as well. So people who have lived experience in either social work space, either the mental health route or substance use route, and really help people in their recovery journey, whatever that may look like. It could be more of a harm reduction model that's initiated by their therapist and their peers helping them kind of hold them accountable. Say your therapist recommended that instead of drinking 6 beers, let's work on drinking 5 beers. How is that going? Where do you find yourself in your spectrum of your recovery journey? And peers really kind of helping them, hand-holding them in their recovery process. But CORE and CAFDIS, it takes a long time to get approved by OMH, so we're still waiting for that designation, but definitely is going to be an enhancement of services overall. But CCBHC has a very clear criteria of what they want us to deliver, right? So some of it, like I mentioned earlier, is crisis services. So we do have an after hours line, but also working with, after the operating hours at the clinic, how are people getting services, right? We have our phone number, but also what partnerships can we develop within our communities for people who may need more of a face-to-face kind of intervention. We're also working with not just outpatient mental health, because that's what we do well, but developing an SUD team or department within our mental health clinics. So like I said, mental health doesn't function in siloed anymore. So we're having a nurse, a KSAC, a peer as well, all of them who are going to be trained in very specific modalities to help with the substance use population, to really help them in their mental health journey, but also in their substance use recovery. We currently have a SUD program out in Brooklyn that we have been utilized for any kind of resources or any kind of support that can happen either via phone or telehealth, because we understand that some parts of Manhattan are closer to Brooklyn than others, but we have that resource available to some of our clients who may, not just clients, but also like their family members who would need some support in the recovery journey of either a loved one or their own personal recovery journey. Person and family-centered treatment planning. So we pride ourselves on being able to complete treatment plans, people setting very concrete goals in their treatment and recovery, but also making sure that these goals come from clients, not something that's mandated by like a therapist, really working collaboratively to be able to provide treatment planning for our clients, community-based mental health services for veterans. And so this is something that we're actively working with, developing a partnership with the VA in Harlem. Providing mental health services for either people who don't qualify for VA services for a host of reasons, or may not be inclined to utilize the VA services, that we can be an additional level of support. And so we are in the process of training our clinicians to provide that level of therapy for this very specific population. Peer family support and counseling services. I mentioned earlier that we have peers available to provide more hand-holding or concrete support for a lot of our constituents. Similarly to the earlier presentation around navigating ACS, some people may benefit from having a family advocate to address some of their needs, whether it be more of a clinical need or more of a navigating school systems, navigating ACS systems that can be very complex for people. And sometimes it's just helpful to have another person who's with you, who may know the system themselves because they've experienced it themselves or have been trained, and they can be able to provide you support in real time. Targeted case management, I kind of talked about earlier. We have both Bridges to Care, which is our short-term intervention, and our care coordination teams, which is our long-term care coordination or care management teams. Outpatient primary care screening and monitoring. So we've recently hired a nurse. So part of our intake process is not just focusing on the mental health, but also having a nurse assessment to making sure, are you seeing your primary care doctor? Is your BMI in an adequate space? Do you have other medical complexities that can be impeding on your mental health, or vice versa, right? Having that nursing staff available is going to be crucial in understanding that holistic model. Psychiatric rehabilitation services, they're called PRS for CCBHC, they're PSRs. So that falls under the core and CAFCAS teams that we're still waiting for approval. But again, it's another level of service and support, generally under the kind of care management model with peers, as well as supporting the psychiatric rehabilitation services, just really kind of making sure people are as stable as they can be in the community. And lastly, screening, diagnosis, and risk assessment. So we're screening from the moment they are coming through our doors, but making sure that our screenings are up to snuff. But sometimes, if we're dealing with a new population like substance use population or veterans populations, these are generally screenings that we never really had to do. But now we are welcoming these new changes and new screenings, because we do understand that we need to be able to identify things that maybe in the traditional mental health model, we weren't really looking for it. But now that we're here, we understand that we need to start shifting our mindset of not just mental health, but also other modalities. Okay. So why am I presenting to you guys is, so we want to spread the information of the CCBHC model. I feel like Jewish Board is a very big organization, but it's also people who may know us for one specific thing and not understand that CCBHC is new. And so we're definitely welcoming a lot of new demographics and populations that we're working with, but also we are struggling with the community support. And who else could we go to beyond the community board, right? We are actively working towards prioritizing some of these, a long list of partners that we're actively trying to look for. So some of the federally qualified health centers like the Ryan Center or Settlement are two organizations that we've met at some of the community fairs that you guys have hosted on your resource site. And so that's been a great help. So we're working through getting the FQHCs. We have a relationship with the VA, and so we're kind of finalizing those processes. But it's really hard to kind of find someone in a hospital setting. We understand that the HHCs, like Harlem Hospital, is around the corner from one of our clinics. Literally, it's in walking distance. And so, but it's been such a challenge to find people within the human services or the health services space to really kind of partnership and tell them, hey, this is something new that we're doing. If you have a person who's either coming out of the hospital or either on an inpatient or an outpatient basis, please keep us in mind if you want to refer them for services that we are able to offer. And we're struggling. So this is a reason why I'm coming here to share the wealth, but also to understand and maybe how we can kind of work together to make these partnerships happen. So inpatients, psychiatric hospitals is definitely a big one. And I know Harlem Hospital has a very extensive inpatient psychiatric unit. We're also working with trying to get like MAP programs, so our methadone maintenance programs, right? We understand that this is something that our clinics don't have the physical space to handle, but if we had a partnership of someone who is interested in participating in an MMTP type of program, we can say, hey, we already know a person, let's call them and let's get you set up for intake, right? It's easier when you already know a person or already know that you have a relationship versus just kind of calling out of the blue. Emergency hospitals is also a big thing. We want to be able to establish those relationships that, like, people come in for CPAP, right? They'll come in for a short-term immediate hold, but then who are you referring them to? You can refer them to us because we're around the corner from the hospital, right? But also, like, down the future, we would love to kind of expand our partnerships and relationship with schools and child welfare agencies and justice systems and a whole host of other human services providers. But right now we're trying to kind of, strategically work through the hospital systems because those are bigger and harder to get through. And then we'll start blending into other CBOs in the area. Just kind of let people know that we're here, we have this support available. One, let's educate each other on the services that we have, but also two, how can we work smarter and not harder for a lot of our services. And so that's pretty much it. So again, my name is Norma Cruz-Judanea. If anyone has any questions or concerns, I can share the slides. I also have a flyer of our Manhattan CCBHC that I can share with the community board so that can be disseminated amongst everyone. I can also drop them off as well if it's easier. And I also have listed as our one call number, which is our main line for any kind of referral for services. If you just say, hey, I need services for mental health, or I need services for my kid, and you tell them where you live, they'll tell you the closest proximity and what works for you, and we will get them connected to services. So thank you, Community Board 11, for allowing me this space to present. And if anyone has any questions, I am here.
Thank you very, very much, Norma, for your very thorough presentation. I definitely want to just circle back with you about how I can help with connecting you with people, or at least we a lot of organizations come before the community board, and one of the things I'm working on now is just creating this huge referral network for this type of reason. So it would be good to just connect on, before I say that, I think you should go also to the Youth and Education Committee to present. I'm not sure if you're already scheduled to go with them. They meet tomorrow, so you probably would need to get on the June calendar if you're not already on tomorrow's meeting. But the Youth and Education Committee would be a great place to go to get to speak to people who work in the education sector here in East Harlem. But we should talk about just getting connected with grassroots organizations and just the like, and just I also want to just speak with you about like, and Michelle, you too as well, like just how to communicate.
We do medication assisted treatment.
Yeah, so I just want to be able to communicate the services to people when they have a particular need. So just making sure that I'm on point with how I refer people and where I refer people. So I'll circle back. I just wanted to say all that, to say that I'll circle back with you about that. Yeah,
Much appreciated.
yeah. Yes, you have a question in the room, Mark?
Hi, Norma, thank you again for the presentation. There's so much to take in. But I'm understanding, I think, that this CCBHC is a state-funded sort of program that many organizations apply to be a CCBHC to provide these services to the community. Is that I think is correct? And
Yes.
I'm looking at a list of all of the CCBHCs that exist in New York State. And there are a lot of them, but they may not be overlapping in terms of neighborhoods. And so I guess my question, since you're looking for customers, forgive me for reducing it to that, but you're looking to make connections with people who could use your services. Are these other CCBHCs in New York State experiencing the same issue of getting the word out and getting people to utilize their services? Or is it something more specific to your program and or your location?
So that's a great question. Because CCBHCs run the gamut, right? And so how people can understand and interpret the criteria. Some people may already have these partnerships available, making it that it's easier for them to say, hey, yeah, I already know a substance use program. We've already referred tons of clients there before. We just kind of need to like dot our I's, cross our T's, right? And so those kind of relationships may already have happened. And those CCBHCs may not have such a hard time. For us, right, we don't have those relationships. So we're really starting from scratch, primarily because our CCBHC hub is functioning out of 2 clinics, right? So we have one hub with all the rules in the world, but we also are functioning out of both Harlem and Washington Heights. And we've never done anything to this degree where we are partnering with a lot of community-based organizations because Jewish Board is so large. A lot of our services are internal. But a lot of our services that now CCBHC is asking for, we don't have those internally. So we've never had to say, if a person has a substance use program, we'll just Google it and send it. We want to be able to not only just provide people information that they can Google and then go. We want to make sure that 1, we provide the referral, 2, that they go, and 3, if they don't go, let us know what happened. Right? What are the barriers to happening? Some of those can be concrete. Some of them can say that, they may not have had a great experience, but also if they do what's going right? And we can also kind of track our partnerships and say, hey, look, we've sent 10 clients to your clinic. All 10 of them have gone and reported back great outcomes in this relationship. This is exactly what we want to happen. Because sometimes what will happen is a referral will be made and then nothing happens. We are responsible for, especially in the CCBHC model, so not just refer, but also making sure we're doing this with intentionality, we're doing it with purpose, and people are actually getting the services that they need. So I don't know if that completely answers your question, but other CCBHCs may be having an easier time with this, but we are in a different stage, which gives us an opportunity to grow a lot further.
Okay, thank you. That is just more information, very helpful.
Any other questions in the board members?
I just need the slide.
The slides?
Mhm.
Oh, yes, could you send us the slides, please, Norma?
Yep, I can send it over.
Yeah, along with that flyer. We love flyers here.
Yep, I can definitely send that over.
We put all of them on Marlene's desk.
Yep. Marlene, I will send that over to you.
Thank you. Any questions from anyone in the Zoom space? No? Okay, thank you very, very much, Norma. I'll be in contact with you. I'm so happy Shannon here to be in contact with. I'm trying to strengthen my referral game. Cause I mean, seriously, cause I'm like here on 116th and Madison, and we're at the church, so people come with every need under the sun. And sometimes I don't always have the language or information ready that I wish I did. So I just want to strengthen my capacity to be able to give the correct information and or have it ready and accessible to people when they come. So I'm just throwing that out there as my own accountability, you know.
Well, to that point, I can always say we do have a I'm losing my words, our advisory board, community advisory board, that is comprised of some clients and also a community board 12 member. So if anyone from community board 11 would like to participate, that'd be great as well. But part of the feedback was just that, right? Is we have all these services, but it's so much sometimes that it's really hard to kind of disseminate what is appropriate based on people's needs. And so the feedback that we received, and we brought up to our leadership was, we need a newsletter. We need some space, one centralized location where we can say, hey, these are the services that are happening. These are the community referrals or fairs that are happening in the community. These are also some of the programs that we're developing that people may not be aware of, that, how do we disseminate this information? And we have also hybrid and in person. So having those flyers available of what's going on in the community this month, and then also being able to disseminate it via email, that may help what you're talking about not knowing what specific provider with specific referral is appropriate for each person. So once we have that up and running, we're working with a patient navigator to develop that newsletter. We can also kind of share that information as well.
Okay, thank you for that. That's cool. All right, any other questions from anybody?
We would probably have her fill out a questionnaire. She didn't do
Oh, great, so, thank you, Marlon. So and I'm surprised, so, I thought, I'm slipping. So I'm also going to, if you don't mind, Norma, we usually ask organizations to fill out our organizational assessment form, which gives us like a more comprehensive understanding of the organization and the services you provide, if that's okay. I thought we already did that. I guess I don't know why I thought that. It also just makes me think it's a few other people I need to circle back. So, yes, I'll, it was class time. Yes, so I'll circle back with that form. It's a Google form. It'll take some time, so take your time to fill it out, but it does just give the committee a better understanding of the organization. It also helps with this referral, with the referrals as well.
Absolutely.
Cool, I appreciate you. All right.
Thank you.
Yeah, have a good evening.
Have a good one.
All right, yeah. So, we don't have any old business for this evening. We're gonna just postpone our review of, prospective budget requests. And, Gina, I will bump you during the month with any, like, reminders about just preparing for next month's meeting. I need to confirm whether I'll be here next month or I'll be traveling, so Jen may be chairing our meeting next month. But I will definitely either be on Zoom if I can't be in person. But I'm going to a conference and I think it might overlap with that day. So we'll pick back up our conversation on prospective budget requests, especially since when we come back in September, we'll be like rolling right into budget season. So, that's where we're at right now. Any new business? Yes, please.
No, I want to ask a question about that. What can we do to help you in that conversation about budget requests? We started to talk about it a little bit last time we were together, and it made me think about like finding documents to support points we may be making. But I'm kind of lost as what those points will be. So if there's a document that you want to share and advance that conversation, that would be great.
Yeah, I will definitely do that. I was telling Isaac, I was in Nepal for work, for 2 weeks and I just got back, so.
You were in Nepal for work?
Yeah, so I'm just catching up
Wow.
on life and,
Right.
so.
And to a lower altitude.
Yeah, the lower altitude is much easier to breathe here. But I will be putting something together and there'll definitely be areas for folks to kind
Thank
of
you.
chime in. I just,
Didn't want to
I
go
always
forward, yeah.
anticipate doing more work when I'm traveling and then it just was
You're traveling for work or you're traveling for?
for work.
Oh, okay. You were doing work.
I was doing work, but not this way.
That's cool.
All right, so, anything else? Dr. Brandon, how you doing?
I'm good.
Cool. How's work today? Good. All right, yeah, we're finished. We have an early ending to our meeting, so we can adjourn this meeting at 7:06 if there are no objections.
Pause the roll,
Yes,
Just want to know.
sorry.
no problem.
Roll call, guys.
Mark Grzebski,
Present.
Brandon Gillespie,
Here.
Jennifer Meyer,
Present.
Isaac Scott,
Present.
and Robin Stration.
Present.
100% attendance.
Thank you very much.
State committee smaller, but this is what I.
And thank you again for joining us in person.
Yeah, what happened
Appreciate
there?
it.
So she didn't rejoin,
So,
the board.
right, that would
Yeah.
be the motivation I like to find.
Yeah,
This is such a elaborate.
yeah.
I don't understand. This is calls out for AI.
Yeah.
Doesn't it? Like someone
But
puts
this
it.
file, like, is for like, that's like, oh, like.